think of what we do.
Oh,
That's great. This I can do, you know?
1 minute. No, right?
Mm-hmm. We drop.
Well, I think we're all here.
I feel like we're watching a rocket.
He's
We're-
he's
Last
in Ohio.
Oh. You want to count down toward the end? He doesn't.
Yes.
Title.
I couldn't find countdown to the end in your app music library.
This thing talks to me like I'm like, I'm not talking to
Mine, I just
Watch for you.
I just made mine.
Oh, you probably have to turn the volume. Yeah, these things have a mind of their own. I know. My husband hates it. I'll be in a meeting and I'm like, what are you doing?
You can't say anything close to A.
Yeah, thanks. But it's a little bit too close to. I don't even.
Among those who have brought timekeeping devices to the meeting, we now have a consensus. We're not really sure what time it is, but
It is 5:30.
we have a
You're ready to
consensus.
go.
We have a consensus that the appointed hour has arrived. So if we could all stand and raise the flag right after me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. As previously noted, welcome everyone to the January meeting of the Porter County Board of Health. Let's kind of get a little closer real quickly. Let's go through the room. There aren't that many. And identify yourself and tell us why you chose to join us this evening.
Andy Burbridge, I'm the Director of Development in the South. Kendra, I'm the Office Manager.
Jess Mahler, Director of Nursing. I'm here because I have to be.
I love the honor.
I was going to say because they made me. Matthew Paul, Administrator.
Him too.
Roddy, Health Officer.
Kim Brunt, Board Member.
Sylvia Graham, Board Member.
Linda Boxen, Board Member.
Michelle Cherry, Board Member. Robin Lane, Board Member.
Chris Osan Shepherd. Sorry, I apologize.
He's our resident wise.
Gotta have one,
Yeah.
at least.
Alan as I'm the Superintendent of Portage Township Schools, and hopefully I'll join all of you.
Awesome.
Today, indeed this morning, the Board of County Commissioners have made 2 appointments to the Board of Health. One of which is a very familiar face, and the other one is a new face among us. Linda was reappointed to a new 4-year term on the board, and we're all very thankful. Wisdom and her knowledge and her excitement about this job to us. Sometimes I deal with her enough that I'm not sure she has a real job.
It's gotten better.
I think that this is what she does. Her compassion and her love for this is demonstrable. So thank you for your willingness to step forward again, and we look forward to having your wisdom on the Board of Health. On the other end of the spectrum, we have a brand new person whose face is not as familiar, at least in this context. I'm sure there are probably days that she wishes her face was not discernible as that. But the second appointment, Amanda is here. Amanda's real job is as the superintendent of the Portage school system. So do we have a chair we can bring Linda up? No.
Amanda,
Amanda up.
Yeah.
come up and sit with us.
Do you mind if I move this jacket?
Yes. That's my jacket.
No,
Be careful.
you can move it. That's what he.
Should we scooch down a bit?
Yeah, we can scooch it down.
Amanda, why don't you tell everyone a little bit about yourself?
Okay. You want to give her your little mic?
Yes.
Works. So first of all, I'm really grateful to have this opportunity. It truly is something that I find very encouraging to see, to be able to be a part of. I am a Portage High School graduate myself. My husband and I reside in the district, and our two children, we had one who just graduated last year, and our youngest daughter is a sophomore at Portage High School. I've been in the district for 22 years. After graduation, I went to Purdue West Lafayette, came back, I've taught there. I was a curriculum coach, a principal, a director, and then I've been the superintendent for 10 years, just marked 10 years in December. Time flies, but I will tell you that the opportunities and the ability to be able to connect families with resources such as those that the Board of Health offers is something I'm really excited about. The opportunities that exist that some of our at-risk families are currently not taking advantage of for various reasons. I'd love to determine what those barriers are alongside all of you and see what we can do to close those gaps. There is no doubt that I recognize the at-risk populations that we serve in Portage, but I'm committed to however we can work together, fully knowing that it does obviously take a village, and the more we can wrap around families and students as community, the better off all of us will be so that they can thrive and flourish. So I'm excited, I'm honored, and I look forward to working with all of you.
Well, welcome.
Oh, thank you.
We look forward to you bringing your perspective and wisdom to the board and to the staff and to the department. So
Thank you.
she was appointed at 10 o'clock this morning, and
Yeah, that's commitment.
we're working her already.
Like it.
At night. This is the January meeting of the board, and that we refer to as our organizational meeting. I guess I should tell people I'm Dave Hollenbeck. That's our organizational meeting traditionally. We're going to put a little different nuance on this tonight, and I'll talk about what our goal is to accomplish this, and then we can implement the strategy, hopefully. Linda has been our chairperson for 3 years. She has led us through what some people might call a living hell. And she did it very well. And we are very appreciative. The very survival of some of us at the health department are directly attributable to Linda's ability to take care of us, so to speak. So we're very, very appreciative of that. In talking to Linda about where we're going to go from here, it became apparent that 3 years as the chairperson is maybe more than we could have asked for in terms of her involvement. That being said, she was more than willing to proceed into that 4th year, but indicated an inclination to want to see what members of the board we have who are inclined to step up and bring their leadership to it, to the table. And so instead of asking for nominations and seconding and getting a chairperson this evening, and with Linda's acquiescence, I'm going to solicit from our board people who would like to take on that challenge. That isn't that Linda is not inclined to do it, but we'd like to get the juices going, so to speak, and get some type of hierarchy in place so that we have a plan. I know I'm not, at 78 years of age, I know I'm not going to be here forever. Although if it's in the cards, that's fine with me. And Linda knows as well that she's not going to be here forever. She's already left a legacy and has already left her stamp on this department. So what I'd like to do this evening is, instead of implementing the process of electing a chairperson, I'm going to suggest, and hopefully the board will acquiesce, that you all think of what your roles could be and how you could enhance those roles and better the people of Porter County for your service, including conceivably considering serving as our chairperson. Give that some thought, and let's reconvene at our February meeting and have a discussion about what each of you should come with a piece of paper, and written on that paper is what you see as your role at the health department. And that may well include suggesting you're ready after a number of years to take on the challenges that Linda has faced. On the other hand, it may lead us to the conclusion that a fourth year is in the works here in terms of Linda, and she's cognizant of this and is
One more. Max.
she's already limiting her. But let's think about what we can do internally within the board, and come to the February meeting with a look on your face that tells me that you're ready to rumble. Any questions about what I am proposing? And that's basically delaying the choice of a chairperson until our February meeting.
No, we have a homework assignment.
Can we do this for the lawyer too? So,
Yes, we can. I can give you homework assignments.
all right, then I'm going to keep control of the gavel. You can't.
If I don't want to, that's okay. If I could just make a statement regarding Terry Wolatich, who she retired from the board. She had served 2 terms, right? And so she's who Amanda replaced today. But I just wanted to put forward my thanks for her time. We didn't have the opportunity to do that for her since the way this all kind of played out happening today. But I am very thankful for her 8 years of service on this board. She was always a very wise, calm, collected, great source of input, and had a lot of passion for the people of our community. And I'm thankful for her service to this community and to this board. I appreciated sitting with her at this table.
Comment well taken. Okay, not hearing any objection, I'll assume that we're going to proceed as I indicated, and we'll go back to the agenda. And I'll entertain a motion to approve the minutes of your December 2nd meeting.
Motion to approve.
Second.
All in favor indicate such by saying aye.
Aye.
All opposed? Your minutes of the December 2nd, 2025 meeting are approved. Our next meeting, we've already alluded to, will be February 3rd of 2026. Under the new business category, the Valparaiso Family YMCA South Porter County Wellness Initiative proposal will be brought before us.
Long time no see.
Yes.
Could you identify yourself?
I'm Wendy Burbridge. I'm the Director of Development at the Valparaiso YMCA. And I prepared some information. I want to thank you for having me back today. And I appreciate your time and opportunity to return with a revised request. I want to begin by acknowledging that the Porter County Health Department experienced a significant funding cut, and that is understandable as it changes what is possible and how priorities must be balanced. So I just want to acknowledge it. I do understand and respect that. But again, I appreciate this opportunity. So thank you again. That is exactly, I'm presenting a proposal that is smaller, more focused, and more flexible, while protecting what is already working. The South Porter County Wellness Initiative is a preventative wellness program serving the rural communities of Hebron and Couts through a partnership with the Porter County Health Department and the Porter County Public Library System
It provides free wellness classes such as gentle yoga, strength and balance, and other evidence informed movement programs that support obesity prevention, chronic disease prevention, mobility and balance, and a reduction in isolation. Since July, we've held 20 classes with 140 total participants, averaging about 7 participants per class. And we've seen a steady repeat participation. What we've learned is that these classes are not only supporting physical activity and wellness, they're also becoming a point of connection for residents who don't have access to a gym, who may not feel comfortable in a gym setting, or who need a safe, community-based option close to home. We've also received strong feedback from library partners and participants that many individuals in these communities have limited social contact, and this has become one of the only consistent wellness and social opportunities they participate in regularly. The original version of this proposal reflected a full year vision and budget. Based on your feedback and funding constraints, we revised the request to focus only on what is essential and to shift additional costs to the YMCA. I want to highlight the 3 key differences. Difference 1, the request is much smaller and focused only on instructor wages. In the original proposal, the budget included categories such as mileage, marketing, and contingency costs. In the revised proposal, those categories were removed. The YMCA will absorb those costs. We narrowed the ask to instructor wages because instructors are the core element that makes this program possible and ensures consistent, safe, high-quality programming. Difference 2, the YMCA is absorbing more and sharing in the investment. The revised proposal clearly states that the YMCA will cover, including mileage, outreach, and staffing support as needed. We made this change to demonstrate shared responsibility and reduce financial burden to the health department, especially in the current environment. And difference 3, the revised structure gives the board flexibility. The library-based wellness classes are the core request. So at Hebron and Couts, the cornerstone, the expansion with that church is presented as an optional second component. If the board is able to support both, that expands access. If the board can only support the library portion, the base program remains strong and continues to serve the community. To close, I want to thank you again and allowing us to return with a revised proposal. This request is designed to reflect your funding reality and sustain a proven program that aligns with prevention and health access goals in rural communities.
Thank you. Are there any questions from the board?
Where is the Cornerstone Church?
It's in Couts.
Okay.
And I am not from Couts, so
I was just curious what the actual location.
yeah, it's a large. They have a gym, an actual gymnasium that isn't being fully utilized. So we have had conversations with them about partnering to provide this more expanded, and it will differ slightly from the classes that are provided at the libraries in Couts and Hebron.
So they'll be maybe on different days and different times.
Yes. Yeah.
People could access them.
Right. So the plan will be for Thursday afternoons, and we will do 3 consecutive classes. So there'll be 3 different offerings, and we'll be offering childcare. So the Y offers Child Watch services for its members, and that's at no cost as well. And so it made sense to do a little bit expanded offering, since we want more of the community to experience the classes. So, offering childcare is a way to do that.
So the 12 1-hour classes per month for 6 months. There's 3 classes, so there's 1 day a week
Yes.
at the
Yes.
library and 1 day a week at the
Correct.
on
Yes.
days.
Correct.
Okay.
Yes.
Any other questions? Does the staff have a recommendation from the board?
I think this is a much better proposal than before. I would love to see it, give it a chance.
New and improved, huh?
Yes.
And you know, we had a lot of feedback and a lot of concerns based, as she mentioned, our financial limitations and the things that we were capable of assisting with. And so you really went above and beyond with the YMCA to address those concerns and then absorb some of the costs. So I think the shared partnership in this platform works a lot better with our constraints, because we never negated that this was a great thing. Is can we do it, and is there enough to sustain it and grow it, and this seems, in my opinion, for me, would work better.
One last chance.
I thank you guys for coming to the table.
Yes.
I mean, so quickly too with
Absolutely.
last meeting.
Yeah. So wonderful.
Commendable. Yeah.
Well, I appreciate the opportunity. Thank you for being open to that.
With the presentation and the board questions and inquiries and responses, I'm going to close that process, and I will entertain any motion that a board member may have regarding this reconfigured Y proposal.
Motion, the South Porter County Wellness Initiative.
Second.
Is there a second?
Couple.
Second.
Why don't you call the roll?
Yes, sir. Dr. Fox,
Yes.
Dr. Brunt,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Roseanne.
Yes.
Thank you.
Thank you.
Thank you.
Thanks, much appreciated.
Under old business, this is not the report of an old attorney. Jeff, you want to come up? As you recall, we have a position at the health department that Jeff currently fills for an emergency preparedness coordinator. And because of a propensity of the state to be dilatory in getting their grant awards out, back when the fiscal year for the state started, back on July 1st, we did not feel comfortable fully funding or agreeing to fund a full year of Jeff's work for us, because we didn't know we were going to get a grant or not. Well, we did.
Finally.
Isn't that great? And so Jeff is here this evening, and I've worked with him to implement the second half of what we've already committed to do with him, which started January 1st and will go through June 3rd. Any question? You understand what?
So do we do this again in June? How we do? Okay, so this grant.
Yeah, a full fiscal year for the state is July 1st of one year through June 30th of the next calendar year.
Okay.
That, you know, for after doing this for 50 years, I'm still confused.
It's always been confusing.
Because the state fiscal year is different than local government fiscal year. The state fiscal year, as I said, is July 1st to June 30th. We go on a calendar year basis. Yes. Can you tell us a little bit how your first 6 months went?
The first 6 months went well. I mean, we had our deliverables to do, although we didn't have a contract. So we continued to do the deliverables and actually got the first 2 quarters done. So it was, every meeting was, you know, do we have a contract? Do we have a contract? And it was held up at the state level through the various offices that it needs to go through. So we handled everything on our end. It was submitted. And then it was just a matter of it working through their system. So hopefully this year goes a little smoother. We're already expecting the notice for the next budget period to come out in the next month or so. So
Oh, okay.
hopefully we get that and everything will proceed smoother for next year.
What particular challenges do you think you're going to face in the last 6 months of this agreement?
The last 6 months, one of our bigger deliverables coming up is we need to do a tabletop with some administration. That was the kind of the goal they have set, and it's really the scenario that I'm building out now will involve a tabletop discussion, which could involve various offices, whether it's the auditor's office and various things, because it would be we'll walk through the steps of if we have another large scale event, how do we accept grant money? How quickly can we accept that grant money? Who can sign off on contracts in a short period of time? How we would handle situations like that. That'll be the first the first step of a kind of a 5-year. Actually, it's the second step of a 5-year plan that the state has. This one is going to be relying on us to do this discussion based event. So that I'm planning now and trying to figure out which parties will have all at the table.
Very good.
Participate in that.
As you may remember, Jeff's position is a little unique in that he is a contract employee, and his contract is with the board. Not normally, the health officer is responsible for hiring and firing and manipulating things around. Jeff has a relationship with an agreement directly with the board. So what he's here this evening for is to get that approval for the second half of his coordinator position. I'm looking, I didn't look, about $28,000.
That sounds about right.
Yeah. Which is half of what he would get normally. Absent any other questions or concerns or comments, I will entertain a motion to approve Jeff's second half commitment to us as our environmental coordinator.
Motion to approve.
Second.
It's been moved and seconded. Can we take a roll call?
Yes, sir. Dr. Boston,
Yes.
Dr. Brunt,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Osai.
Yes.
Well,
Thank you.
welcome again aboard.
Yep. Thank you.
Official.
So yes, you can put up with it for another several months.
Yes. We're lucky to do so.
Don't leave. I've got the paperwork from the state, and that you and I need to go through, and you need to sign.
Perfect.
Okay.
Yep. Thank you.
Thank you.
Okay, the next on the agenda is the approval of claims and receipts. Hopefully, you've all had a chance to look at those. The staff
Yeah.
or I,
Back up. Yeah, right there. We've all seen.
staff or I can hopefully answer any questions you may have. Absent those, we will entertain a motion to approve the claims and the receipts, which are now rolling around in an anticipatory fashion that you're going to approve.
Yeah, motion to approve.
Second.
It's been moved and seconded. Could we have a roll call vote?
Absolutely. Dr. Boston,
Yes.
Dr. Brunt,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Osai.
Yes.
Thank you.
Moving right along, the next matter on our agenda under the reports of committee, staff, and health officer. I don't care what order we take it in. It looks like our health officer is grabbing the microphone.
Bittersweet announcement. This is Demetrius's last Board of Health meeting.
Boo.
He's moving back to Fort Wayne to bigger and better and leaving us behind.
Oh.
But you can see Dan and Mandy are trying to learn the job tonight. So yeah. So they'll be ready in February. But just want to wish Demetrius well and good luck in your next journey.
It won't be as nice as Valpo, you know.
I really appreciate it. Thank you, Doctor.
Yep.
I've had a really great opportunity to work with all of you, do amazing assignments, be a part of a lot of firsts, a lot of initiatives and whatnot. So I really appreciate the opportunity, everyone. So thank you so
You've
much.
done a great job. There's so
You
much
really
new
have.
innovation and the publicity and the information. It's really, in my time here, I noticed a huge amount of difference with all the work that you've done. And I, for one, appreciate it very much. And I hope you get to be creative like that wherever you're going next, because you have a lot of creativity, and I appreciated that being incorporated in getting information out there.
Thank you so much. Well, I got some bad news. We did not get the Subaru grant. So
The which one?
the Subaru is for the purchase of AEDs
Oh, okay.
and cabinets. But there are some more opportunities that we're going to be applying for. So you guys may be hearing about some other things that you can try to do very soon. So, but that's really about all I have. Let you know. Oh, and Demetrius will be doing a little bit of work for us still from Fort Wayne.
Oh, okay.
He will be messing with our Facebook page a little bit.
Okay.
Because that's something that he can do from there very easily with his expertise. So.
That's it.
Jess, you want to talk?
Wait. She's speechless.
Weird, right?
Listen, it's almost 6.
Anything else in the realm of committees, staff, and health officer information that's important for the board to receive?
I have to note, I loved Jamie, your report and like your goals that you have, these things that you're trying to do for outreach. I thought that was really innovative with a position that's only been around for what, a year and a half. You know, you've accomplished a lot, and I look forward to seeing more of the combined efforts with us and the school systems. I know there's more projects coming up too, and now having a school superintendent on the board, I'm very excited for that connectivity between us and school families and helping assist. But I was really impressed with that. And Jess, your year roundup was pretty awesome too. I have to give you that. It's nice to see. What were the numbers that increased? Something increased by a ton. What was it that we did? Like,
No, the increased like twice over STD test.
oh, it was like foods, I think, in terms of what you've collected in the last month.
That's good.
What? Sorry, that you guys, your outreach has been great. But how did that happen? Was it because we can get the point of service in payments there? That was just that made that much of a difference.
We brought on a new software program in the last year, Fetch, and we were able to fine tune that system. It's a database, that we were able to fine tune over the past year. And between our administrative team, Mandy and Lisa, they got everything out earlier. So all the renewal applications went out a lot earlier in October. We were able to follow up through November and into December, and we just saw a huge return coming early. So we were up over $38,000 in collections.
Compared to last year, which makes life easier for you. I know for when you have to kind of chase these down. If we have a system that can handle these things,
I like it when it's.
I know. That was impressive.
Right, there's still a few out.
There always is, but that was impressive to see. I couldn't remember exactly. I don't have my binder with me with all my notes. I forgot it at home, but I appreciated your noting of that.
Hearing no one else wanting the floor for comment, question, or concern, and absent anything substantively left on the agenda, I'll now turn to the miscellaneous portion of the agenda and again ask if there's anyone who's bubbling over with excitement about something called miscellaneous. Seeing none, we'll move along. The last item on your agenda, and indeed can be the most important, is public comment. And I have a stinking suspicion there won't be any, but I think for purposes the record will solicit anyone participating in this meeting in the form of public comment. Hearing no one inclined to do so, I will entertain a motion that the board pack it in.
Motion to adjourn.
Motion
Second.
to adjourn.
Second.
Second, all in favor?
Aye.
All in favor, stand up.
Yay.